One state has a bigger goal in mind when it comes to health care reform. Vermont wants to become the first state in the country with a universal health care plan, also known as single payer. Here's what the plan projected for 2017 would do. Replace employer private insurance with universal coverage. It would increase efficiency and lower overhead costs. It would also try to ensure every Vermont resident is covered for primary, preventive, and chronic care, as well as urgent care in hospital services. Vermont Senator Bernie Sanders has been championing this type of system for years. Senator, good to see you here. And, you know, when you look at the plan, some might say, you know, is it too ambitious given what we're seeing with the Affordable Care Act? And you can't help but make some of the parallels there. What do you think?
Well, I think quite the contrary. I think what we have to understand is, compared to the rest of the world, the United States of America is the odd guy out. The system that we have in this country, or I should say the non-system we have, allows 48 million people to have no health insurance, many more to pay high deductibles and co-payments. And despite all of that, at the end of the day, we are spending almost twice as much per person on health care as the people of any other country, and our health care outcomes in many ways are not as. So I think in Vermont we're beginning to see 2 points. Number one, should health care be a right, R-I-G-H-T, for all people? And I think most of us believe it should. The governor does, our legislature does. Second of all, how then do we provide quality, cost-effective health care to all of our people? And I think the conclusion that we have reached is that if you like, a Medicare for all single-payer approach is the best way to do that. We already have a very, very strong children's health care program. It's called the Dr. Dinosaur program, very, very popular. We have a very strong community health center program providing primary health care to a whole lot of people. So we're making good progress. I think we've got to go further. There are some concerns here. Robert Zirkelbach, spokesman for the National Trade Association for the Health Insurance Industry, telling the Associated Press this, quote, "This plan could disrupt coverage consumers and employers like and rely on today, limit patients' access to the vital support and assistance health plans provide, and put Vermont taxpayers on the hook for the cost of an unsustainable health care system." What do you say to his criticisms there? Well, I say it's very understandable. He is paid by the private insurance companies to represent their interests. I'm sure we're going to have other spokesmen from the pharmaceutical industry who are also going to be attacking us. Nothing new there. These guys are the reason why the United States has the most inefficient and wasteful health care system in the entire world. We are spending 30% of our health care dollars on administration and bureaucracy. We pay the highest prices in the world for prescription drugs. And we have a system which does not emphasize disease prevention, does not emphasize primary health care. It is an incredibly wasteful and bureaucratic system. These guys make zillions of dollars in profit off of that system, and of course they're going to oppose us or any state that wants to go forward in a new way. As you very well know, universal care has been the goal of Democrats for decades, and I want to play a little bit of sound from then Senator Obama and Senator Clinton talking about it in the 2008 presidential campaign. Take a listen.
The very first promise I made on this campaign was that as president, I will sign a universal health care plan into law by the end of my first term in office.
It is time for us to come together and start living up to our own values, to provide quality, affordable health care for every single American. And I intend to be the president who accomplishes that goal finally for our country.
So, Senator, Obamacare is not universal health care, of course.
No.
So is that ideal for another generation?
Well, we've got to, we have got to continue the fight and, again, understand, and I think with a great deal of embarrassment, that we are the only nation in the industrialized world not providing universal quality health care for all people as a right. So the fight has got to continue. The point that I would make is that health care is different than...
When do you see that happening based on that ideal?
Well, I think it's a political issue. It's when, well, frankly, if Vermont can lead the way, and if Vermont can show that we are providing health care to all of our people in a cost-effective way, taking the health care burden, by the way, off of small business. So this is not only a health care issue, it's an economic issue. If Vermont can succeed, you know what? New York State or California may go next, and then you will see state by state. Eventually, the entire federal government will move in that direction. But we need some good models out there to show that a single-payer system can work. I hope Vermont leads the country in doing that.
Vermont Senator Bernie Sanders, thank you for your time on this Saturday.